Hello, my name is Yvonne. I'm with JK Lifestyle with Yvonne. Today we have Iris Waichler on. I wanted her to come on because she's a social worker. She's had over 40 years working in that field. One of the things that she is an expert on is infertility and aging and caregiving issues. And I really wanted her to come on and talk about that because that's something that I think has affected so many people in the past, in the present, and in the future. Hi, Iris. How are you?
Good morning. It's nice to meet you, Yvonne. I'm good. Thanks for having me on the show.
Thank you for thanking me, but I'm so glad that you took the time to come on. So that's both of us are thankful.
Yes,
Okay. Could you tell me a little bit about yourself?
sure. As you said, I was a social worker for over 40 years, and a lot of my work was in the hospitals. I was a physical medicine and rehab social worker. So my patients were people who had life-changing diagnoses, people with cancer and strokes and amputations and head injuries and burns. So huge life-changing situations for not only them, but for their families. And I also covered the ER where people would come in an instant, their life would change. Someone would have a car accident or an overdose or whatever. So I worked a lot with people whose lives were changed and they were extremely vulnerable and they didn't know what to do or how to manage or how to cope. And in addition, on a personal level, my mom had breast cancer and it metastasized to her brain. And she was very young. She died when she was 56. Um, so I helped take care of her. And when it metastasized to her brain, she wasn't really able to let us know what she needed or what she wanted. And it created an angry outburst. Her personality totally changed. She was a loving, wonderful mother. So that was really difficult. And then my dad, we were very lucky. He lived to be 97, God bless. But he also, I was his primary caregiver too. And he was very healthy for a long time. But with a lot of older people, what happens is you have a cascade of medical problems. So he got pneumonia, and then we found he needed a pacemaker. And then he started sundowning and getting some cognitive issues. And then his mobility got more limited too. So I ended up helping take care of him. So I've had, and in addition, I also have helped two friends who actually were my age. They didn't have families, but they had families of choice, and we helped both of them to die with dignity. So I've had a lot of experience personally and professionally with caregiving and with illness.
What does being a caregiver, what does that involve?
It involves a lot of things. It involves doing the physical work, helping people doing what they need to do. Right. Most recently with my husband, he had a back surgery a month ago, and he couldn't go in the shower by himself. He couldn't bend, so I had to help him with his shoes and get him dressed, and he couldn't lift anything over 5 pounds. So I had to lift the juice bottle and the iced tea and things like that. But it also involves doing a lot of emotional work too, because when you're taking care of someone, you see someone you love in pain or someone you love changing. And so it's emotionally tough for them, and it's also emotionally tough for you. And also, it's a huge juggling act for caregivers because they have to juggle their personal lives, their relationships, if they're working, and if they're people in the sandwich generation, they're taking care of their kids as well as perhaps a parent. And so it involves a lot of juggling and also a lot of sacrifice, personal sacrifice, because you have to figure out how to manage your time, but also take care of you. And that can be really hard when you're being pulled in so many directions. Helping people physically too also can put a strain on your physical health. One of the things that I see the most often is the biggest mistake that caregivers make is they wait too long to take care of themselves because we're so focused on taking care of other people. And the majority of caregivers are women, over 70% are women. And women are so great at taking care of everybody else, but we're not so good at taking care of ourselves. So the biggest mistake that caregivers make is they allow themselves to get burned out because we don't think about what's going on with our bodies, with our minds, our emotions. And by the time we recognize it, it's too late and we're suffering burnout. So one of the things I always recommend for caregivers is to be very aware of what's going on with you, because if you're burned out, you can't be a good caregiver to the person that you're taking care of. So um, physically, there are changes that happen. Our bodies talk to us. A lot of times with caregivers, there's a lot of lifting and moving and bending. And so they can get backaches, they can get body aches, they can get headaches. They lose sleep because they're worried. I can remember laying looking at the ceiling, waiting for the phone to ring at midnight, because that's usually around the time I got emergency calls about my dad that he was heading to the ER. So that's physically what to look for. Um, Emotionally, what to look for is there's feelings of depression, of anxiety. You feel hopeless and helpless because sometimes you can't change what's happening, especially with people who have progressive illnesses like dementia or Parkinson's disease or Alzheimer's. Um, and there's also a lot of guilt too. And there's guilt, and again, because we're women, we're really good at feeling guilty. And there's guilt because we can't always help the person the way that we want to. There's guilt because we can't be all things to all people. We're focused on taking care of the person we're taking care of. We may not be able to do our jobs. We may not be able to focus on our kids and the kind of things that they need help with. So there's a lot of that. And also some of the signs for behavioral burnout is if you find yourself becoming more irritable, becoming angry, becoming frustrated, and lots of times people get more isolated when they're a caregiver. They don't have the energy to go out and be with other people. Sometimes you sleep too much when you're a caregiver because you're so physically and emotionally tired. And sometimes you can't sleep because you're laying there worrying about all the things that are going on and thinking too much. So loss of sleep or too much sleep are symptoms. And also sometimes when people are so stressed, they may turn to alcohol or drugs to kind of help with it too. And that's another sign if you're those things are increasing, that there's something going on and you should pay attention.
When you said that you had two friends and you helped with their care and you helped them die with dignity, how did you help them die with dignity?
What I did was, and for both friends, because they didn't have family in the area, their friends were their caregivers. And so what we did was we let them die on their own terms. One of my friends, she loved the beach. And the hospital that she was at, it's the hospital I worked at actually. We weren't that far from the beach, so we got permission to take her to the beach. So I would take her there, and other friends would take her there. And then when the time came she couldn't come anymore, one of our last visits at the beach, we took a shoebox and we filled it with sand and shells and things like that. And when she couldn't leave the hospital anymore, she'd say, I want to go to the beach. And we would pull out the box and she would put her hands in the sand and close her eyes, and she would touch the shells and she would imagine being at the beach. And we talk about being at the beach. So she told us what she needed and what she wanted. And my other friend, the same thing. He loved music and he wanted to be at home. And so every day when I sort of was in charge of putting things together. So I helped get the visiting nurses in, I helped get the medical equipment. His brother lived in another state and came, and they were in very different places about what they wanted to happen. My friend had a very aggressive brain tumor, and he knew he was going to die. He was not at all afraid of dying. He was the most fearless person I'd ever met in all the years I've been doing this, I have to say, because he felt when he died, he would be in a place that he described it to the social worker as this. He said, when you're on earth, you're like this, but when you die, you're like this. Your spirit and the world is open to you. So he wasn't afraid, but his brother came, and his brother wanted him to fight. He wanted him to get chemo. He wanted him to do all these things that he didn't want to do. And so one of the things that I did was I helped his brother understand that and appreciate that he needed to control the terms of how he died. He wanted to die at home. He wanted to die with as little medical intervention as possible and with help from people that he loved and cared about to be around him. And so part of my role there was to help them talk about and communicate about it. And in fact, I was there in his final minutes, and it was really incredible. My friend was a Buddhist, and the Buddhist that the person that was head of the Buddhist place where they went to pray had a bracelet that he'd given him, and he told my friend, "When you're ready to die, it's time to take the bracelet off." And I could tell he was going to die shortly, and I called his brother over and I said, "It's time." His brother took the bracelet off, and he died a couple minutes later, very peacefully, very peacefully. And his brother came to terms with it, and because he came to understand and respect what his brother's wishes were. So it was a very peaceful death, and that's what we wanted to do, was to help them have peaceful deaths on their own terms.
You're making me tear up. I reached for it too.
Oh, I didn't mean to do that. But that's what I mean. I think that people, when they can, it's really important to have a say about how it's going to happen, when it's going to happen, and whatever you can. I made a mistake. We all did made a mistake in my family with my mom. My mom was so young when she got sick. She was 50 when she had breast cancer. And we didn't really talk about what do you want to happen when you die? What kind of care do you want? Where do you want to be? Um, and so she was healthy for 5 years. And then on her fifth anniversary, she went to the doctor, and that's when we discovered it metastasized to her brain. And it affected her thinking, and it affected her communication. So I couldn't ask her those questions. So that's one of the things I would really urge your listeners to do. That's another huge mistake we make. We wait too long to have the caregiver conversation. And we wait because it's a really scary thing to talk about. None of us wants to think about dying. None of us wants to think about losing people we love the most. But it's really important to at least open that door a little bit while you can, when everyone is healthy. And so what I always recommend that people do is to talk with their aging loved ones, or their partners, or their adult children about what when I want to, when I'm getting sick or I'm getting older, what do I want to happen? And if you're talking to like a parent, for example, you come from a place of love. You say, "I love you. I want to know exactly what you want, because I want to respect your wishes, and I want to do as much as I can to help you live as long as you can and as healthy as you can." And then you raise questions like, when you're getting older and you get sick, do you want to stay at home? Do you want Are you okay with family taking care of you, or could we bring in professionals if you need it? Do you want to be in the hospital? You can raise all these kinds of questions. And so it's the greatest gift you can give the person that's going to be taking care of you, knowing what their wishes are. Because for me, one of the hardest things about losing my mom was I was making choices, not knowing what she really wanted me to do. We decided that she needed to be in the hospital because she was having really terrible seizures, but maybe she wanted to stay at home even with that. I never knew. And so I did have a lot of guilt about that when I was taking care of her. And we learned that lesson. So with my dad, immediately when my dad was in his 70s, we had a long discussion about it, so that I knew exactly what he wanted me to do. And it's a huge burden taken off of you.
I know, I was just thinking, I lost both my parents, but I never stopped to think about what they wanted, or, um, you know, I never stopped to to ask those kind of questions. So,
Yeah, it's really important. And also just having information of it, just on a very concrete, basic level. One of the other things people don't do is, I call it a roadmap, and the roadmap is information about your insurance, about who you want to make decisions, if you have a will or a living will, or who's going to power of attorney, healthcare power of attorney, who's going to make those decisions. Um, all that kind of information, as someone who's a potential caregiver or is a caregiver, you need to know where that is. Because if you're making decisions, even if you're going to be having someone come in like a nurse or something, you need to know what the insurance is, just very basic stuff, so that you can get that, make sure that's happening. I did that with my dad. It was the cabinet, and in that cabinet, I knew where everything was. My dad, I was cleaning out a drawer of his and I found an insurance card. He was a veteran. And when I looked at him, I said, "What's this?" And he said, "Oh, it's some card I got from being in the Army." Well, it was a card that reduced his medication by 60%, the cost of his meds. And
Mhm.
so you're so overwhelmed when you're a caregiver. There's so many decisions you have to make, and having as much information available beforehand makes that role so much easier. And I guess the other thing I would say is caregiving is it can be really hard and challenging, but it can also be really beautiful. There's beautiful moments of intimacy, like what I described with my friend and his brother being there and witnessing that. And so, one of the things that I always recommend to caregivers to make that role easier is to try to create moments of joy together. And so, for example, my cousin, we were very close with them. My cousin, she died recently, and her kids were my age. I grew up with them, and so every week her son would open a photograph album with all these pictures of family, and they would reminisce and talk about the family, and she would remember and tell him stories about our family, things he never even heard. And that's one of his most cherished memories now that she's gone. With my dad, when we'd visit him, there was a rooftop garden at one of the places he was at, and he loved to be outside. So we'd go up to that rooftop garden and spend time together. And he also stayed at a place, I'm in Chicago, and it was near Lake Michigan. So we'd go out for walks and walk by the lake. And I have wonderful memories of that time together. And if you have someone that's not mobile, you could listen to music. You can even get up and dance together if someone's got that mobility. Watch a movie together. What things that you both enjoy, and those moments together can be so beautiful.
What made you specialize in people that are, or the role of a caretaker? What made you, I mean, for me, I think it would be kind of draining. I think it would be emotionally, um, take so much out of me emotionally to care for people, knowing that they're not going to get any better, that they're going to get progressively worse, and be terminal. I know my mother said one time, it's different if a person is sick and you're going to take care of them, they're going to get better. But it's just watching them sink to new levels of illness and the symptoms, how they feel. And how did you manage to go through that?
I think that's a really good question. I think two things happen with us as caregivers. We lose people twice. And I think this is a really important point. When we're taking care of someone who has a progressive illness where they are going to die, we lose the person that we know and love. We watch them change physically and emotionally and behaviorally. And then there's the actual moment when they die. So we lose them twice, and that's so hard. But for me, I'll tell you how I started with all of this. And it was many years ago. I was on in the hospital walking on the floor, and I walked by one of my patients' rooms, and his family was at the door, and they were sobbing. And I looked in the room, and he was just getting an EKG. He was perfectly okay. The resident had gone in and hooked him up, and he didn't take the 10 seconds it takes to tell the family, "I'm just doing an EKG just to get a baseline." The family thought he was dying because he was hooked up to that machine. And it really hit me hard. And I went over and of course I explained to him he was fine. But then I thought people need to have as much help as they can when they're at their most vulnerable, when a person you love and care about is sick and needs help. And I realized it was important for family members as it was for the patients. And so I started writing books to help people address those issues. So that I wrote a book after that called Patient Power: How to Have a Say During Your Hospital Stay. Just putting information in there, questions that people, if they knew to ask, could make a world of difference and lower their anxiety and help empower them. And so it's kind of been my mission ever since then to it's the social work part of me and the personal part of me. I want to give people information and help them see other people are in the same situations they are, because you feel less alone when you understand that what you're feeling is normal and okay. And so I've done a lot of workshops and counseling too to help people too with those things. I do podcasts like this to just teach and support people and educate them and give them the tools they need so they know where to go to get help that they need.
Yeah, you wrote 3 books
Yeah, I'm working on a fourth right now, actually.
and you have 14 awards from the books.
Yeah, yeah, yeah.
Mhm. Where are your books available at? On Amazon?
There, yeah, the first book is out of print because I wrote that in the 1980s, the Patient Power book actually. But the other two are on Amazon. One's about infertility, and my latest book is it's called Role Reversal: How to Take Care of yourself and your aging parents. And you can get that at Amazon, or you can go to any local bookstore and they can order it for you if you ask for it. The book I'm working on now is about trauma, to help people with trauma and for first responders, people like firefighters and EMTs and paramedics, a book to help them and their families.
Why? What help do they need and their families?
It it's incredibly stressful. And you described watching someone that you care about, how hard it is. Well, imagine doing a job where you go in every day. Part of your job is running into emergency situations. It's not just fires, it's people that drowned, it's people that have been in car accidents, it's mass casualty situations, things like that. And repeatedly doing that and what that does to you emotionally, even though that's your job, um, it affects your personal relationships. It affects your personal health, your physical health, your emotional health, and sometimes. And what do you do with those feelings? And what do you do with that when you leave the job? If you put it on a personal scale, like a caregiving scale, that's just with one person. And there's a lot of emotions and a lot of things that happen to you, as I talked about earlier, with your body, with your mind, with your emotions. And that's just one instance. And if you multiply that many times for first responders, it's pretty overwhelming, even if they're professionals. Because we're all humans, right? We can't change that. And we all have feelings about how we interact in the world and with other people. And so it's really important to understand that and know what to do.
Um, this is the last question I wanted to ask you. Suppose you have a relationship with someone, could be married, could be family or whatever, and someone is slowly losing their health. It may not be something where, terminal, but it's a slow decline. Does that change that relationship?
Well, it absolutely does,
How?
because it changes it because, particularly if it's a partner or someone that where you've developed a relationship and boundaries, and one person does these things, jobs, and one person does this in the relationship and in their world and in their environment. And when one person can't do that anymore, then everything shifts. And also emotions change. As I said earlier, when you see someone you love in pain or not be able to do things, and you know it's a degenerative kind of situation where it's not going to get better, it's going to get worse, that affects the relationship too. And also, there's a lot of grief that goes on with that. Your emotional relationship changes. You're grieving the loss of the person you know and love, and that person may be grieving. And lots of times when people have health issues, whether it's physical health or mental health, and it's progressive like that, it changes their personalities. They get angry, they get irritable, they strike out, they they change, and the person that's the caregiver gets the brunt of that. And so there's a lot of emotion around that. And there's a lot of one of the main things that we feel is guilt too. Guilt because we want to be there to help, but there's a part of us that says, I need a break. And guilt because we can't change what's happening. Um, Guilt because we can't do more. And so uh, those things tend to be really heightened in a caregiving relationship when the scales sort of shift a bit in terms of who's doing what. And I guess that's one of the other things I always say to people. this isolation thing is really, really hard. You don't even have the energy to go out and do things when you're being a caregiver and doing the rest of the things that we all have to do in our lives. So I always tell people it's really important to make time for yourself. It can be as simple as going to the bathtub and giving yourself a bubble bath, or reading a book, or having a glass of wine, or going for a walk. But finding someone in your life too that you can talk to openly and candidly about what's going on is really important too, because you need someone you can talk to about the impact of being a caregiver and what that's doing, the good and the bad things about it. It's really important. And the wonderful thing about the world today is we have 24-hour access to people on our computers. So even if you can't give yourself permission to physically get out, there are lots of websites you can go to with chat rooms. There's Family Caregiver Alliance. There's the your local area on aging office, or the National Alliance for Caregiving. Those are places you can go to anytime, and they have support groups online where you can go and talk to other people that are in a similar situation, because it's so helpful to know that others are experiencing what you do, and you can get tips and information from them that'll help. Your local area on aging office also has information too. There's a site called caringforthecaregiver.org, and that has information too. But taking care of yourself is super, super important.
I know when I was growing up, um, I had godparents, and my godfather said to me one time, his wife had passed, but he said that when she knew that her health was really declining, she went to him and apologized. She said, "I'm sorry, I've been such a burden. I feel bad." And he just said, "Oh, stop talking like that. You're gonna see me going." But it's like she was aware that she couldn't do the things that she used to do, and it was falling on him.
Mm-hmm.
Felt bad because of that. But
What a gift he gave her, huh? It's really interesting when my mom she was really, really sick for over a year, and she wouldn't let anyone but my dad take care of her, even though I tried to help and bring people in. Anyway, she changed, her personality changed, and she would scream and shout and was really angry and all that. And she was in the hospital, and I was there, and it was the morning, and the doctor said she's going to die shortly. And I called my brother and sister. My brother was in California, my sister was in New York, and I said, "Get here right away." And that day, we got a gift. She came back, the loving mother that she was. And she also hung in there until my brother and sister came many hours later that night. And we all got to say our goodbyes. She told us how much she loved us. She thanked us. It was a very beautiful, peaceful moment. And then, literally, when we were all there around her bed, she said her final goodbye, and she died. And I was so grateful that she came back and we got to say what we wanted to say, and she got to say to us how much she loved us. So that was a wonderful gift.
okay, today we've met with Miss Iris Waichler. I'm so happy she came on. Some of the things she said brought back memories of what I went through with loved ones as a caretaker. It's information I wish I had known before. It kind of was thrust on me gradually, so I didn't really notice it. Um, but thank you so much for coming on today.
Thank you, Yvonne. And I wanted to say one more thing, if
Happy
I
that
could.
you did.
I'm sorry, didn't mean to make you cry. I just wanted your listeners to know, Monday through Friday, I'm on Facebook, and I'm on Twitter, and I publish articles about caregiving and information and resources and all kinds of stuff. So I just wanted to let your listeners know where they can find it, because there's tons of information and resources there for them. So my Facebook page is www.facebook.com/role reversal / that's Facebook. And on Twitter, I'm at twitter.com/IRISWAICHLER. And that's a really great place to get a whole lot of information and support.
Mhm. Okay. Thank you, everyone, for joining us today. Thank you, Iris. I
Thank you,
appreciate it.
Yvonne. Thanks for the work you do.
Thank you. Bye-bye.
Bye-bye.